Hi everyone, I'm Michelle Lincoln from the Faculty of Health Sciences. The Wobbly Hub and Double Spokes research team is a multidisciplinary team based in the Faculty of Health Sciences. And the somewhat unusual name of our team is an attempt to capture the complex and unbalanced delivery of allied health services in rural and remote Australia. And our research has shown that things are indeed pretty wobbly out there. The problem that we're addressing is that there is reduced access to allied health services for people living in rural and remote areas. This is combined with the fact that we know that health outcomes for people in rural and remote areas, and in particular our Aboriginal and Torres Strait Islander populations, are worse than for those living in metro areas. So we have this situation of reduced access and increased demand. The approach that we're taking to this problem is to design and test a range of telehealth approaches to delivering allied health services. So the picture that you can see there is a speech pathologist in Manly working via video conferencing with a child in their local school in Quirindi in central New South Wales. We're doing this in partnership. As part of the partnership, what we do is go through an iterative cycle of formative results. So we generate research results using an agreed evaluation framework. We feed those results back to the organisations fairly quickly, and we work with them to translate those results into new and better versions of each of the service delivery models. It is research translation the fastest I have ever seen, even to the point sometimes where they're wanting to translate the results and we haven't finished analysing the data, which can be problematic in some senses. The evaluation framework that we use is holistic, so we collect, using qualitative research methods, stakeholder feedback, which looks at the feasibility and the acceptability of telehealth service delivery. We've been pleasantly surprised by how feasible and acceptable people resident in these communities find it. We're also collecting a range of client outcomes to demonstrate the efficacy of the telehealth approach. We're generating a range of results. And this is just a bit of a snapshot. We have established that telehealth speech pathology services delivered in schools is both feasible and acceptable to school principals, teachers, parents and the children themselves. In fact, some of the children preferred the telehealth rather than the face-to-face sessions. I'm not sure what that's telling us. We also, through our quantitative analysis, have established that children can achieve their speech goals via the video conference treatment sessions only. So for some children with some types of problems, there was no need to travel to access services. Sometimes people are travelling hundreds of kilometres, hours of time off work to access services, so that perhaps that is no longer necessary. Another model that we're using is using video conferencing to support allied health assistants and support workers in local communities to deliver services face-to-face in situ. And we're finding that this is a very efficient and economical way to deliver those services. So it's a combination really of the face-to-face support that a lot of people require, particularly if they have children with disabilities in their family, and a clever use of video conferencing and technology to enhance those services in places where allied health professionals are unlikely to ever live.